So, is Coea Delta providing more than supportive therapy for our COVID 19 patients?
Yes, about probably 2 weeks ago when we had our first patient that was really struggling in the ICU, was intubated, had actually been a patient for, I would imagine, more than 2 weeks. Ultimately, she did pass away, but we began using a combination of hydroxychloroquine and azithromycin. Those two drugs together are being used in what they call compassionate care situations. They certainly were never designed to try to treat the COVID-19 virus. They were designed to treat other viruses, but they have proven to be fairly successful in the treatment of COVID. So there are a number of studies that are underway right now to determine the efficacy of these two drugs together, as well as other therapies that have been pursued. One of the most promising right now, and you've probably been hearing about a blood test that is actually, it already exists. I was listening to the news last night, and it's been available in Germany now for more than 3 weeks. And it's a blood test that detects the antibodies in somebody that had been infected with the virus but has now been essentially cured. So they are now virus-free, but their body then develops the antibodies. And that those antibodies are in our bloodstream. They actually then will extract the plasma that our red blood cells flow through, but to actually extract the plasma from those cured COVID patients and inject it into patients that are sick, really hospital patients that are in the ICU, that are intubated, and then with the hope of those antibodies now attacking the virus and potentially curing them as well. So that is probably one of the most exciting developments that we're hearing about right now, and the fact that it already exists. And this type of therapy has been used in the past, but obviously this is a new virus, so we don't know yet if it's going to be effective, but it definitely appears to be promising.